Welcome back. It can wake you in the middle of the night or interrupt your workout routine. And then there's the crossing your legs when you sneeze. Ladies, do you always have to make sure you know where the nearest restroom is in case you have it? Perhaps you have urinary incontinence. Let's learn more about this morning. Joining us from Spectrum Health is Dr. Sharma, female pelvic medicine and reconstructive surgery. Good morning. Thanks so much for joining us.
Good morning. Thank you for having me.
Absolutely. All right. So first of all, let's talk about how common is this?
So urinary incontinence is more common than you would think. Stress urinary incontinence symptoms, or that kind of urinary leakage that you have that's associated with physical exertion, has been reported in 1 in 3 women to some extent over the age of 45. The other kind of urinary incontinence, that gotta go feeling or sense of urgency and feeling like you always have to be in the bathroom, which is called overactive bladder, has been reported in up to 15% of women across all age groups. So it's pretty common.
So let's talk internally. What's going on? What's causing all of this?
So the most common factors that cause urinary incontinence are age. So women who are increasing in age will experience more symptoms of urinary leakage at both of those times. Also, increasing weight gain or obesity can also be a risk factor for urinary incontinence, as well as number of pregnancies that a woman has had in her life. Other factors that can play into it can be medical history, surgical history, family history, and also dietary choices.
All right, so at what point do you just tolerate this, or should you never really just tolerate it and really kind of seek out some treatment?
Sure. So it's a quality of life issue. When a woman feels like her quality of life is being affected by her urinary incontinence and she's modifying her daily activities just to avoid leakage or manage her leakage, that's when she needs to reach out for care. So many of our patients, when we see them in the office for consultations, state that they've been having symptoms for years and suffering from urinary incontinence. And when they find a treatment option that works for them, they wish they would have pursued treatment sooner.
All right, let's talk about some of those treatment options that are available for ladies out there.
Sure. So treatment options really span the gamut as to what's available. So they can be conservative, such as dietary modifications or pelvic floor physical therapy, medications, non-surgical interventions, and ultimately surgical options too. We do strive to work with the woman and the patient to find something that fits her goals and needs and fits into her lifestyle. So there's not really a one-size-fits-all approach.
So I think we need to put that final push out there for ladies. What advice do you have for them so they don't think that it's just part of life?
Sure. So while urinary incontinence, like we discussed, is common, it's still a subject that most women have a tough time talking to about their providers, given the sensitivity of the problem. If a woman feels like she's doing things during her life to avoid urinary leakage or cope with her leakage, and she's cutting back on how much she's exercising or changing her activities during the day or not playing with her kids, then that's the time to really go and seek treatment, because there are treatment options that can cause significant improvement in quality of life for women.
All right. Well, thank you so much for your time this morning. I know we have a lot of ladies watching this morning, and this one is actually something they can really relate to. Thank you so much.
Thank you.
Absolutely. For more information, visit 4069 Lake Drive Southeast at Suite 118. Go ahead and give them a call, 616-267-8520. Go to spectrumhealth.org/women's center.